Welcome to the Deep Dive. Today we're digging into something that might sound pretty routine, your annual and regular diabetes reviews in primary care. Now, we know these appointments can sometimes feel, well, like just another thing on the to-do list, maybe even a bit rushed. But our goal today is to really unpack why they're so vital, what actually happens, and really importantly, how you can get the most out of them, make them work for you.
And getting the most out of them is so crucial. These aren't just tick box exercises. They have real predictive power because diabetes, if it's not closely watched, can, well, quietly lead to some really serious long-term issues. We're talking things like sight loss, amputations, unfortunately, kidney problems, even heart attacks and strokes. These reviews are specifically designed to catch those early signs, those whispers, giving you and your team a chance to step in early.
You mentioned some really serious outcomes there. So for someone managing their diabetes day in, day out, maybe feeling okay, what's the kind of less obvious reason these checks are still so important? What else do they offer?
That's a really good point. It's not just about stopping the worst from happening. The real why is, I think, about proactively protecting your quality of life long term. These reviews significantly improve glycemic control, that's your blood sugar levels over time, which is just paramount. They are absolutely fundamental to reducing and, preventing those complications. And maybe something people don't think about as much, they actually help with sticking to medication plans. It's that regular contact, that conversation that keeps things on track. I mean, just to give you an idea of the scale, in one area alone, Lancashire and South Cumbria, there are over 115,000 adults living with diabetes. It just shows how many people need this kind of consistent, proactive support.
Wow, 150,000 in just one region. That really does highlight the need for effective management, doesn't it?
It really does. And it's worth just quickly mentioning whether it's type 1 diabetes, the autoimmune kind,
Yeah.
or type 2, which is about 90% of cases, often linked to lifestyle, but definitely progressive if not managed. The need for early diagnosis and that regular, consistent monitoring, it's vital for both. Absolutely vital.
So the message is clear then. Even if you feel absolutely fine, these checkups are essential. Your body might not be sending obvious signals, but things could be changing under the surface that only these tests will pick up. It's about sort of looking ahead. Okay, so let's shift gears a bit. Let's get into the actual review, the nuts and bolts. If you've got one coming up, what should you really expect? You said it's quite comprehensive.
Yeah, it really is. It's designed to cover all the key bases related to diabetes and your health. So first, you'll have the basic physical measurements: height, weight, they use that for your BMI, your body mass index, and of course, your blood pressure. Checking strain on your cardiovascular system. Then a really critical part is the blood tests. They'll take a sample to look at a few key things. Your HbA1c, that gives the average blood sugar picture for the last 2 or 3 months, very important measure. Also your cholesterol levels, the fats in your blood linked to heart risk. And kidney function tests too, checking how well your kidneys are filtering waste. Alongside the bloods, you'll need to provide a urine sample. That gets sent off to the lab too. They're specifically looking for tiny traces of protein, often an early warning sign of kidney disease. Right? Then beyond those, you have the more specialized checks. These might not happen in the exact same appointment. Sometimes they're separate. There's the diabetic eye check. This is usually a different appointment altogether. They take photos of the back of your eyes, looking for diabetic retinopathy, that's damage to the blood vessels caused by high sugar levels. And it's really important to stress, this is not the same as going to the optician for a regular eye test for glasses. It's a specific health check. If everything was clear last time, they might offer it every 2 years instead of annually. Then there's the foot check, super important. Your feet should be properly examined during your review. They look for nerve damage, circulation issues, any sores or problems. Again, maybe every 2 years if your previous check was clear. Oh, and if you're on insulin, they should also check your injection sites or your pump infusion sites for any lumps or bumps, like lipohypertrophy, which can affect how insulin works. And finally, perhaps the most crucial bit is the discussion with your healthcare team. This is where it all comes together. You'll go over your results, the HbA1c, cholesterol, blood pressure. It's your chance, really your time, to talk about any problems you're having with your diabetes, general health, anything. They'll talk about potential changes maybe to your diet, your activity levels, your medication. Discuss side effects too. They might also ask about smoking. They can offer help to quit. And sometimes about psychological health, like feeling down, or sexual health issues, because these can be more common with diabetes and need to be addressed.
That does sound incredibly thorough. Is it always done in one single appointment? It seems like a lot to fit in.
Yeah, good question. Practices do vary how they structure it. Some will split it. You might have one appointment, maybe with a GP assistant or a nurse, for all the measurements, the bloods, the urine sample, kind of the data collection bit. And then a follow-up, maybe a phone call or another visit with a GP or a specialist nurse to actually discuss the results and make a plan. It often makes it more manageable, actually.
Okay, that makes sense. So thinking about all those different parts, how can someone listening really prepare? How can you make sure you walk away feeling like you got your questions answered and the care was right for you? Preparation sounds key.
Oh, absolutely. Preparation makes a huge difference. First step, usually, is booking that blood test. You generally need it done a week or two before the main review chat, so the results are back. Now, for cholesterol, you might need to fast for about 8 hours, so usually overnight. No food or drink except water. If you take insulin, definitely talk to your team beforehand about how to manage your dose to avoid a hypo during that fast. That's important. Next, gather your info. Bring your blood glucose readings. If you keep a diary or use a meter that logs results, bring maybe the last month or two's worth. It gives a real-world picture. Also, be ready with that urine sample. If you need a pot, just grab one from reception beforehand. Easier than fumbling on the day. And, just practically, if they're checking your feet, make sure they're clean. Just basic courtesy, really. But maybe the most vital prep step for you personally is to prepare your questions. Seriously, write them down. This is your dedicated time. Think about, is my medication okay? Any side effects bothering me? How can I handle hypos better? Why are my sugars high after breakfast? Anything like that. Having that list means you won't forget in the moment and you'll cover what matters most to you.
That's really practical advice. And, even with good intentions, sometimes things get in the way. There are practical hurdles. What about common barriers? Like, let's take the urine sample. You mentioned getting a pot, but sometimes it just feels awkward or messy, right?
It definitely can feel that way. But don't let it stop you. Ask for help. Need a bigger bottle? Ask. Find it easier to do it at home first. Ask if that's okay. And yeah, make sure that lid is screwed on tight. Maybe pop it in a plastic bag, just in case, if you're traveling with it.
Yeah.
We heard about someone, Sally with type 2, who used the upstairs toilet at the surgery because it felt more private than walking through the waiting room with a sample. Find what works. The team understands.
Okay, good tip. What about the diabetic eye check? That sounds like it has its own challenges. Separate clinic, travel, the blurry vision afterwards.
Yeah, those are real barriers. The key is planning. Remember, it's not for glasses. It's a health check for your eyes. So don't mix it up with a regular optician visit. Plan your transport. Since the eye drops blur your vision, you absolutely can't drive yourself home. So arrange a lift, check bus routes, maybe ask a friend or family member to come with you, especially if you're a bit nervous about it. We heard from James Bailey, who has type 1. His eye checks caught problems early, fluid and vessel issues, and basically saved his sight. It's that important. Don't skip it because of logistics.
That really drives home the importance. And what about the foot check? Sometimes maybe the appointment runs short or people just feel a bit awkward about taking their shoes and socks off.
Yeah, time pressure is real in clinics and embarrassment is understandable. But your feet are crucial. If the check gets missed because time ran out, you need to speak up. Politely insist on booking another quick appointment specifically for the foot check. Checking them yourself isn't enough. And honestly, healthcare professionals see feet all day long. They are trained, it's part of the job, they really don't mind. To help things along, wear shoes and socks that are easy to get on and off. Simple thing, but it helps. Someone called John with type 2 mentioned feeling too embarrassed to ask. It shows it's a common feeling, but please, ask. The risks of missing foot problems are just too high.
Those are great practical tips. Are there other sort of broader barriers people face, like maybe getting asked to repeat check blood tests done at the hospital and the GP? That sounds frustrating.
Oh, it can be incredibly frustrating. Duplication of effort. If your main checkups happen at the hospital clinic, ask them specifically to send the results to your GP. Then maybe check with your GP practice that they've actually received them and added them to your record. Good communication can prevent that. Another thing can be fear of judgment, or just not clicking with the nurse or doctor doing the review. If that's the case, it's perfectly okay to ask if you can see someone else for your diabetes care within the practice. Or if it's a persistent issue, you do have the option of changing your GP practice entirely. Your comfort and trust are important. Also, sometimes people worry about medication, maybe starting insulin or worried about side effects from a new tablet. It's so important to voice those concerns. Don't just stop taking something. There are often many alternatives now, especially for type 2 diabetes. If one thing doesn't suit you, another might. Talk to the team. And lastly, just life gets in the way, right? Prioritizing other things, work, family, but your health has to be up there. Especially with diabetes, problems can progress faster if you're younger, so putting it off isn't a good strategy. Check your workplace policy. Too many employers have arrangements for time off for necessary medical appointments for long-term conditions.
That's a really helpful rundown of overcoming those potential roadblocks. It really comes back to that idea you mentioned earlier, making decisions together, like setting your personal HbA1c target. You mentioned 48 millimoles or 6.5% is common, but it's not one size fits all, right? It needs to be agreed between you and your team. And the same for medication choices. It's got to be a partnership. So zooming out again, the annual review is like a key moment, a snapshot. How does it fit into the bigger picture, the ongoing care throughout the year, right, from when someone is first diagnosed? What should that whole journey look like?
Yeah, the annual review is like the main anchor point, but it sits within a whole pathway of care. So, at diagnosis, things should kick off properly. A full medical history, definitely. You should be referred to a diabetes education program. Could be a group course like Desmond or Daphne or 101 sessions, tailored to you, your culture, your needs. You should also get info on free prescriptions because in England, diabetes medication is free. If it's type 1, you need a clear individual management plan straight away. Detailed info on insulin, counting carbs, hypos, driving rules, it's a lot to take in. And a dietitian review should happen within 6 months. For type 2, those initial talks should cover weight management strategies, emotional support because diagnosis can be tough, and starting medication, usually metformin first. Then ongoing support needs to be there beyond the annual check. For instance, if your HbA1c isn't quite hitting the target you agreed, you should probably be checked more often, maybe every 3 to 6 months. You should know how to access peer support. Talking to others with diabetes can be incredibly helpful. Mental health support, too, if needed. If you're thinking about pregnancy, there should be preconception advice and then extra support during pregnancy from a specialist team. Help with sexual health concerns should be available, too, and flexibility. Appointments shouldn't just be rigid face-to-face slots. Phone calls, online consultations, whatever works best for you should be an option. That's person-centered care. And all this care, especially the reviews, feeds into managing the key areas: diet and lifestyle. You should get ongoing personalized advice, ideally from a dietitian. Practical tips on healthy eating, getting active, maybe specific weight loss goals like aiming for 5 or 10% loss initially if needed, and sensible advice about alcohol. Blood glucose management. The reviews track your HbA1c target. They also inform whether you might benefit from self-monitoring. That could be finger prick testing or maybe continuous glucose monitoring, a CGM, depending on your type of diabetes and situation. Full training on how to use the kit is essential. Medication management is obviously a huge part. Reviews check if your current meds are working, if the dose is right, if you're having side effects. As needs change, especially with type 2, other drugs might be discussed, like SGLT2 inhibitors. Those are good if you have heart or kidney risks. Or sulfonylureas, which help your body make more insulin. And yeah, many people with type 2 eventually need insulin. If that happens, the team must show you exactly how to inject, rotate sites to avoid lumps, and dispose of needles safely. And finally, that constant complication monitoring. It's what the reviews are largely for. Checking eyes for retinopathy, checking gums, dentists play a role here too. Checking nerves for neuropathy that can cause foot numbness, but also things like stomach emptying problems, gastroparesis, or erection difficulties. Checking feet for circulation, sores, infections. And checking kidneys for nephropathy, using those blood and urine tests we mentioned. Maybe starting an SGLT2 inhibitor if kidney issues arise. It's all about protecting your future health by catching things early.
Wow, that's a really comprehensive picture of the care someone should expect. It's incredibly detailed. But it does raise a crucial question. What if someone listening thinks, hang on, I'm not getting all of that? What if they feel their care isn't meeting that standard? What steps can they take? How can they advocate for themselves?
That's a really important point. If you feel your care isn't quite right or pieces are missing, the very first step, always, is to talk to your GP or your diabetes nurse, your healthcare team. Maybe make a list beforehand of what you're concerned about. Use the info we've discussed today as a checklist, perhaps. Be specific about what you feel you're missing or what's not working. Often a direct conversation can sort things out. If you try that and things still don't improve or you're really unhappy, you do have further options. You can look into making a formal complaint through the practices procedure or NHS complaints process, or you could ask if it's possible for your diabetes care to be managed by a different clinic or even a hospital specialist team. And remember, when looking for health information online or elsewhere, check for quality marks like the Information Standard in the UK. It indicates the information is reliable and evidence-based. You absolutely have the right to good quality care.
That's really empowering to know there are steps you can take. So, wrapping this up, I think the big takeaway for me is that these annual reviews, they're so much more than just a formality. They really are these dynamic, personal check-ins, the absolute foundation for staying healthy long-term with diabetes and being prepared, asking those questions, understanding why they're checking your eyes or feet or kidneys. That really puts you in the driver's seat, doesn't it? It becomes a collaboration.
Exactly. It transforms it. Think about it like this. When you engage proactively, when you understand the what and the why of each part of the review, that checkup stops being something passive that just happens to you. It becomes a powerful partnership between you and your team. And that deeper understanding, that's what empowers you, not just to live with diabetes, but actually to manage it effectively, to really thrive and protect your health and your quality of life for many, many years to come.
A powerful thought to end on. Use this knowledge, engage with your team, and keep advocating for your best health.